So this week we're going to talk about cardiorespiratory exercise testing and prescription. So the next few videos are going to focus in on cardiorespiratory testing methods and the purpose of assessment. So in these videos, we're going to talk about the prerequisites for exercise testing. What do you do first? Contraindications to exercise, different types of tests and why you might choose one over the other. And then we'll also talk about the FitVP recommendations for aerobic exercise. So first, when we're starting assessment, we might have to coach our clients on the purpose of assessment for them to get on board with the idea. I mean, think about it. Like if somebody tells you we're going to take a test tomorrow, how do you feel? Your stomach might start flipping in knots. You might get a little sweaty. You're a little bit nervous, right? Because especially for those of us who grew up with standardized testing is not our favorite part of the day. And that's sad because testing has a purpose, and that purpose is not to determine your value as a person. It's to identify your strengths and weaknesses. Like, what are we good at and what do we need to work on? Where do we have room for improvement? And we can use that information to create goals and monitor our progress toward meeting those goals. And then we can use that information to determine what is appropriate for an exercise program for this individual. So because assessment has a purpose, that purpose is what motivates our clients to participate and to perform well. So before you even start testing, we've got to accomplish a few things. One is informed consent. We talked about that in the previous unit, that you would do that first thing when you intake a client. But if you're working in a clinical setting, you may have a specific informed consent for each test that you perform. So if you're going to do a treadmill metabolic test, you may have an informed consent that you do for that test specifically, and not just an informed consent overall. Whereas in a fitness, like if you're working for a retail fitness center, they may have an informed consent that covers the whole program. So that varies. You want to give your clients pre-test instructions like what to eat, what to wear before they show up. You want to make sure you've done your pre-participation screening to make sure they're healthy enough to participate in these tests that you've chosen. If you're working in a clinical setting, you're getting a referral from a physician, so this part has already been done, but you may be required to document that for your own records. You want to calibrate the equipment to make sure the equipment is working properly and measuring accurately, and monitor the environment. For example, if you're in an indoor environment, make sure the temperature is appropriate, so you have the air or the heat running to make a comfortable temperature. If you're in an outdoor environment, you want to make sure that it's safe from weather-related incidents, and also consider the temperature and humidity outside. So pre-test instructions that you might provide, these are general instructions for all testing. Some tests may have more specific pre-test instructions, but you want to, these factors, if your clients will do them, will help the test be more accurate and precise. So they don't want to eat, drink, alcohol, caffeine, or tobacco right before the test, because that can change their heart rate response to exercise and also change how quickly they get fatigued. They want to wear appropriate clothing and footwear. I don't know how many times I've done a fitness test and somebody showed up in Crocs or Yeezy slides. That is not appropriate. That is not safe. I'm not doing this test because you're going to sprain your ankle. So make sure they know what appropriate footwear is before they show up, right? So if you want them to avoid food and alcohol 3 hours before the test, you've got to give them more than 3 hours notice for that, right? Because they're going to adjust their eating pattern. You don't want to call them 30 minutes before and say, I hope you brought tennis shoes or athletic shoes, because they may be already on their way there. So you want to call them like 24 to 48 hours before the test and make sure they know this information. Hydrate well. They don't want to go run a marathon the day before they come in for testing. That's not going to go well because they're fatigued. They also want to, usually they'll take their normal medications. If you're in a clinical setting and they're using this for diagnostic purposes, the physician may advise otherwise, but that would be the only reason you would tell someone to not take their medication. Testing order. So when we're choosing, we're going to do a bunch of tests for a variety of components of fitness. You want to program it in at minimum this order to make sure that it's accurate and fatigue doesn't become a factor. So you want to take their heart rate and blood pressure first. If you take their heart rate and blood pressure after they've just run a mile or lifted a bunch of weight, it's not going to be a resting heart rate. It's going to be a recovery heart rate or an exercise heart rate. And that's not what we intended, right? So resting heart rate and blood pressure first, then body composition, and then you'll do the other components of fitness. Whether you do cardio first or muscular fitness first may depend on your goals and how strenuous each of those tests are. You want to do usually your more strenuous tests first, and then the least strenuous first test last. And you do want to try to allow for heart rate to get back to normal and muscles to get some rest before you test them again, so that fatigue isn't a factor. When you're choosing your test protocol, you want to limit the number of tests in the category. So like body composition, every test that we get is basically predicting the same factor. The ratio of fat mass is the most common thing that we're looking at. So I only need one test in body composition. Same thing for cardio. Every cardio test is predicting the same value. How efficient is your heart and lungs? So I only need one test for cardiorespiratory. I don't need to do a 1 mile and a step test. I just need one. For muscular fitness though, you're evaluating more specific areas of muscular fitness, right? So if I do a bench press test, I know how strong the chest and the triceps are, but I don't know how strong their legs are. And they could be really strong in their upper body, and they have always skipped leg day, and they're weak in their legs. So we may want to test upper body and lower body. I may even do upper, lower, and core test. So one of each of those body parts. And then if I'm working with older adults, I definitely want to incorporate balance testing because of fall risk with age. If I'm testing athletes, I'm going to incorporate some more skill testing like agility and speed. But that gives you a general outline of how to choose those tests and what order it should be in.